the chairperson, our membership committee, our board of trustee and treasurer, Ms. Judy Wesenhand. Ms. Judy.
Hi, good afternoon to everyone. I would like to thank all of you for being here. Welcome to the first HIMAP Learning Session for year 2022. Okay, so welcome, and I would like to acknowledge our members, our partners, and of course, our guest speakers and panelists. So in today's session, we'll be talking about the healthcare global trends and opportunities in the year 2022. I know that 2021 has been a challenging year for all of us, but we were able to overcome all the trials and challenges due to the pandemic. So in 2022, this is in preparation or more of in support to the plans of our members and other companies, whether it's for expansion or for finding their niche in the market. So we invited experts from the industries. Our guest speaker has been in the industry for more than a decade and has been part of the global operation of the healthcare company. We also invited two panelists. One, as they said, is the walking or sales traveler. They have a global footprint across, and the other one is more of an research institution. So this is a good combination, and we spice up with a great moderator who's been in the industry for the last 17 years now. She's a homegrown talent of the healthcare BPO and have capabilities in business operation, clinical and quality management, clinical training, licensing, project management, and business development. And she is also a registered nurse, both in the PH and USRN. So very in demand. So I would like you to welcome the Director of Service Delivery of Conduit Business Service Philippines, Ms. Catherine or Cathy Gutierrez. Thank you, and I'll give the floor to you, Cathy.
Thank you, Ms. Judy, and welcome to everyone. Welcome to our partners, our attendees, our members. I'm really very thrilled to be moderating the first healthcare learning session today. So without further ado, let me introduce our guest speaker as well as our panelists. We are very lucky today to have a very talented and seasoned guests today. So our speaker today is a physician by training. He is a director for clinical operations and specialized business functions of Legato Health Technologies Philippines. So Dr. Celine is a medical physician and the global healthcare and clinical IT portfolio leader, accelerating healthcare digital transformation. He has over 2 decades of experience in the health and life insurance domain, and he leads a diverse team of professionals across multiple geolocations, managing utilization management, clinical quality, applied IT, pharmacy benefit management, and payment integrity, and financial operations. Please help me welcome Dr. Celine Pataria. Welcome, Dr. Celine, and thank you for your time today. Now, I'd like to also introduce our two panelists who will provide their insights after Dr. Celine's presentation today. Our first panelist is the co-founder and CEO of ADEC Innovations. He is a part of the founding directors and of ADEC Innovations in 1996. The company has grown into a global enterprise with 20 operating companies and 4,800 employees and presence in 17 countries across 6 continents. Wow, that's a whole lot. Totally a global leader. Today, ADEC Innovations is one of the leading players in ESG assurance, and he will talk about it a little while. Promoting sustainable practices combined with professional services, technology platform, and data management. The company's client portfolio covers various industries and practices, which include healthcare, education, manufacturing, apparel, and among others. As an advocate of sustainability, Sir Jim, as we fondly call him, was appointed as the Business and Industry Major Group Representative to the UN Environment Program and leads various initiatives in other United Nations agencies. Sir Jim also serves as a former member of the Board of Trustees of HIMAP. So without further ado, please welcome Sir Jim Donovan. Sir Jim, thank you for being here.
Thank you for having me.
Thank you. And our second panelist is the president of Epimetrics Incorporated, a private health research institution with the vision of health equity through research. And she's also the CEO of Project Forth, a data-driven wellness consultancy firm. Dr. Erica has provided technical assistance to the Department of Health, to the PhilHealth of the Philippines and the United States Agency for International Development for Research, focusing on health literacy, health policy, and access to medicine. Aside from being a researcher, Dr. Erica is also a part-time professor under the Health Sciences program at the Ateneo de Manila University, teaching design thinking in public health. She also obtained her Master's of Science in Public Health with a specialization in health promotion, graduating with merit at the London School of Hygiene and Tropical Medicine, and holds a graduate certificate in technology and innovation from Stanford University. Wow, such an impressive resume. Please help me welcome Dr. Erica Medina. Dr. Erica, thank you for joining us.
Thank you. Thank you. Thank you for having me. And I'm excited for today's session.
Me too. So with that, I think we're all set. We can now give the floor to Dr. Salim for his presentation.
All right. Thanks, everyone. Thanks for having me. I think we'll be investing the next 20-25 minutes to really understand, how the healthcare global trends are unfolding and, how the opportunities are evolving. The perspectives here are we are ourselves part of the healthcare system in terms of experiencing or requiring healthcare needs, and so we are ourselves actually contributing to the changes, and at the same time the work that we do begins to change or transform. So I think the key elements that I would like to bring up through this session is we are having awareness of a lot of the changes or disruptions that are happening, but it's critical for us to really decipher that and be able to carve out a strategy for our niche needs. It could be service delivery offerings, it could be analytics, it could be technology. So what my expectation out of you all is, when you kind of reflect on this session, there are some key takeaways that you have for your respective areas. So with that, we will dive into the session. Let's get started. I think we've gotten through the introduction. Yeah, so my first slide is about the healthcare trends and how do we begin to decipher them and unfold the opportunities that actually mean to us. So nothing new to the audience here. You would be actually experiencing it or contributing to it in some form or shape in your day-to-day work. So what we tried to put here was, classify or segregate the healthcare trends into three broader buckets. In no form or shape, they are kind of, independent of each other. They are very much integrated, meshed, and interdependent is how I would say. So on the left-hand side, you would see that, we have the administration, pillar. So anything that would be related to government policies that will continue to create or, basically trigger changes in the way, elements of the healthcare framework will operate. And I will explain you through an example. And then there's the real-time care delivery pillar, which is the patient, the provider, and the payer. What's happening in that space? And the third one, the platform on which all of this is going to be hosted or delivered is the technology piece. So like I said, all three of them are very much interdependent, and I can kind of share with you just an example, right? So we are all having an overlay of the pandemic in terms of it's been over 2 years that across the globe we've had a need to relook at the way healthcare is delivered. So it started with the need wherein it was practically impossible to visit kind of a healthcare setup just because of the risk of the infection, and that precipitated into the need of digital platforms to help support them. They could not have come in through if they were not really robust enough to help out the physicians, the clinicians, and the nurses who are operating the care delivery platform, care delivery areas. And then it's all funded or maybe encouraged by the government policies. So things like value-based care, all of those elements which I will touch during the course of my presentation. But I wanted to kind of have you just kind of have a look at this in terms of how we've put together the robotics and process automation. You will see artificial intelligence also baked into the technology piece. So there are overlaps, but this was the broader segmentation. And the reason why we wanted to segment it is we will probably need to derive tangible strategies and our next steps basis this. So with that, we will move into our next slide, please. So now that we have seen the larger, I would say, frame or ecosystem of how these trends are basically evolving as we speak, and they're actually unfolding even for tomorrow. All of it has to be seen with the patient at the center. So what's changing with the patient, and what that change triggers is the change in the way healthcare is delivered, the way healthcare will be in the next 12-18 months. So the patient is basically looking for personalization. Personalization just for the reason is that now we have access to real-time data. And once you have a window to the real-time data, you begin to get intrigued that what this data could do for you. And so personalizations become one of the major drivers for the healthcare trends. The second element that I would like to spend time on is holistic health. And primarily earlier on, the definition was health, about health was different. Now it's being kind of looked at in a way where you're looking at emotional well-being, your physical fitness, your ability to basically do integrate the different elements of your health together. And for that you need kind of an integrated model, and you have to have very, very robust touch points. So holistic health is what the patient is looking for. And obviously the cost of care, with all the overlay of the pandemic and the changes that are needed to fund the technology piece and the implementations which were never heard of earlier, it's costing the healthcare system a lot. And so what that's happening is that wherever in the countries where the funding is not done by the government, they continue to get passed over to the end patient. Just from data that I kind of was able to get, the out-of-pocket expenses in this US geography are more than 10% today, which were way lesser. And this is because of budgetary cutbacks, because of additional elements that the organizations have to fund for. So when we are looking at these trends and then keeping the patient at the center, it is very, very logical to begin to think that the way healthcare was delivered in the past is not, it's not going to be delivered today. And the healthcare of tomorrow is going to be a lot different. So what it requires us to basically begin to reflect is the business models are going through a transformational shift. And that I would term as disruption. With that, we can move to the next slide, please. All right. So we talked about trends. We talked about the patient at the center. And then what's critical for us to understand is what's basically changing and how the business model is going through a transformation. It's basically the nature of interactions. It could be a member or a patient with their primary care physician, primary care physician's interaction with a specialist. It could be a healthcare provider talking to a payer. The nature of interactions are changing because the way we are interacting is transforming. It's becoming real time, it's getting digital, and the patient or the member has a window to your back office. Back office means, and I'll kind of elaborate it a little further in my slides, but the nature of interactions change. It triggers a change in the process and technology that supports it. So that's just the lay on which you kind of do the work. But there are people who are doing that work. And who are these people? This is a skilled workforce that is currently employed, have carry their experience and the skills and bring in. But if the platform and technology and the way we interact is changing, we have to really look at what the skills will be for tomorrow. What's the lead time for those skills, and what are the interventions that are needed? So it requires a very, very thorough understanding of the capability models that are currently supporting the current business models. How are they going to shift? And the capability is hinging on the skills. So my slide here basically is just an illustrative example of making us understand that the business model is here for change. And it is changing, as I said. And once the business model changes, it basically begins to change the service delivery model. So if you're looking at Philippines as a geography, there could be setups that are vendors who are basically supporting the bigger organizations in the US, or there could be captive setups. Either way, if the business model changes or is transforming, the service delivery model has to kind of align to the change. So it's very, very important and critical to understand that we may be currently supporting functions today. They are going through a transformation. So, and the ones which we are beginning to engage with our stakeholders and beginning to have interactions that 6 months down, we can do this work for you and we can just do it. I think we have to do a thorough assessment, and I would term it as due diligence and solutioning. And with that element, that this is the process that we are trying to talk about today. This is the function that we are trying to support today. Will it be the process of the function for tomorrow or not? 6 months down, what is the evolution cycle for this function? What's our commitment to our stakeholders? How will we create value for them? So I think all those elements have to come to us from a thinking hat standpoint as we begin to see the business change model getting disrupted. With that, we can move to the next slide, please. All right. I wanted to kind of spend a little more time on walking everybody through what I put together in the slides earlier. So I will just pause to kind of refresh everybody what I talked through. The first part that I spoke about was the healthcare trends. What do they mean to us? Have we been able to segregate, classify them into the broader buckets for us to be able to strategize our next steps? The second piece that I kind of, talked about is how these business models, so this, basically these trends are basically impacting, or changing the definition of a patient need. And once the patient needs change, the nature of interactions change. Once the interactions change, they trigger the change to the business model. It's the way the healthcare is delivered. So if you're all with me, I think this is example that you will appreciate a lot more, because this is happening as we speak. So I took this illustration on home health. If you flip back 2.5, 3 years back, home health was a very small portfolio, within the healthcare space, where people will, take healthcare at their homes. With the pandemic, with the aging population, and the limitations that were set in by the pandemic, there was absolutely a need for helping out patients with comorbid conditions who had the risk of actually acquiring the infection in a hospital setting or in a skilled nursing facility, whichever way. So it was need-based. So need-based triggered innovation, and innovation triggered penetration. So I'll give you an example of the two scenarios here, and I have two more scenarios. I will expand one of them to walk you through how it impacts the business model and how it impacts the service delivery offerings. So the first one is about a regular setup of a diagnosis, how that was happening in a traditional setup. There's a person who's obese and he has potential elements of diabetes. It was all face-to-face. There was a connect with the primary care physician, and an HbA1c was asked, and then there was a tracking around that, put the person into a kind of a case management program. It's all moved over. Now it's basically a teleconsult. And just to share with you, and you will be kind of amazed that teleconsults in the US geography have increased by 38 times. If you were to compare the data from 2020 to now, off the hand, 2020 had about 852,000 teleconsults, while 2021 had 53 million. Now, what it means is there's a huge appetite for this model of service delivery, or healthcare delivery, to really scale up. You look at the other model, where the consult, it was kind of a 27-year-old female, no chronic conditions, goes to the urgent care center, picks up the antibiotics, from there. So it's all face to face. And if you go down, the model is clearly different, and it is in action. So 53 million telehealth consults are basically translating to this kind of a model shift. We can quickly move to the next slide, please. All right. The two other illustrative examples that we've put through is the treatment and discharge and the self-care model. Practically similar. In this case, you would see, an unplanned admission, a case where, a person had chronic obstructive pulmonary disease, diabetes, heart attack. All of these are there, and there was no other option but to get the person into the hospital setting and then getting discharged to the next level of care. What you're seeing today is once the hospital admission and management is done, the patient is moved back to the home setting. One, it basically avoids secondary infection. The other part is now there's availability of remote patient monitoring devices, and that can get followed up through the telehealth consults. There can be meals that can be delivered to the patient home with the socioeconomic setup. And over and above that, I think what probably we need to kind of underline here is the process is changing. Look at the skills. So earlier on, what was happening was nurses were already, trained. Their curriculum was put in place to support more like a bedside setting. Now, if you have a home healthcare setup, you need a nurse who is fully equipped end to end to do everything to support the patient needs, is able to aggregate the data from the remote monitoring devices, is able to connect with the physician's need-based. And so what is basically it is doing is changing. It's basically questioning or maybe requiring us to look at the curriculum and then the workforce mix as well. So earlier on, there would be 3 nurses, basically taking care of, say, 15 patients in a hospital setting. Now you have a nurse at every home because you can't share a nurse from that perspective. So look at the need of, the healthcare needs that are going to go higher, and then the training and the skills that will be needed to support, because the entire delivery platform has changed. With that, we can dive into the next slide. It has a level 2 data, and this is nothing but a care continuum. So you would see, we tried to bring in home the message that how the business model shift is basically going to change the delivery model. Delivery model is how it's going to be serviced, in a setting like ours. So you would notice the chevron on the top is basically, depicting the end-to-end care continuum. So it's talking through how today, in today's life, how, a notification, how does a payer, in this case, gets notified about a potential healthcare need. It could be an admission. So this comes through more like a authorization request. It could be, and the way it comes, which was traditionally coming through was a fax. There could be somebody picking up the phone, and so all of that, right? So then you have a team that's actually trying to do a review of that. It moves down to authorizations. There's a lot of elements which are incomplete. So they begin to circle back. And so there is a dedicated team to really work on correspondences, right? Both from a payer standpoint and the provider standpoint, right? So there is an RCM team that's trying to follow up, for all of those documentations, trying to provide them, and so back and forth. So there's all that intake and triage functions that are currently in place. And then you begin to have the reviews, you begin to manage them, and then there's a post-discharge, handover to the case management, care management tracks. And then eventually, discharge happens. So what you're seeing is the second horizontal, which is talking about the traditional model. It has more than 12, but I mean, what we could list down on the slide was about 12 touch points. They will have sub touch points than that. This is how the patient journey will happen through a service delivery lens. And now if you look at the future state model that I talked about, the home health piece, and I talked about, elements of disruption that are happening, you would see that the intake, notification, and triage functions are more or less being taken over by bidirectional EMR. And what does that mean? That there is a real-time data exchange between the providers and the payers. Once that begins to happen, you really don't need a workforce that actually supported triage and some functions like these. So EMR is taking over. It's real time. Turnaround times are improving. The patient and the providers have real time access, or the window to where their request sits and where their claims are, and when are we going to pay them. So you were seeing that authorization area, is basically having already, changes to the way we do it with artificial intelligence and machine learnings and all of that. So what that is doing is requiring us to have a nurse who's now will have to assimilate, process all the information, and take real-time solutions in terms of decision making. So then you go to the correspondences, that's already taken over by EMR. You really don't need that. You go to the right, the review process, feedback, all of it. You're seeing interventions of all the trends that I spoke in my first slide, which I had classified into the 3 buckets. You will see those elements begin to show and impact the way we are delivering. So the biggest part that is a takeaway from here is not only the skill. I think the other part is the workforce mix. So workforce mix means, I'll give you just a quick example in the interest of time. Today, just throwing a number, right? We have 500 prior authorization requests that come in. And on an average, 380 are good to go for a clinical review. 120 have something incomplete, something which is missing, something additional information, and that lead time begins to happen. So 120 are kicked back into a bucket for the correspondence team and all. Imagine now what's going to happen is there's a real-time flow of 500 requests coming in, out of which maybe about 60, 70, 80, depending on penetration of artificial intelligence, gets taken by auto group routes. You need capacity. You basically capacitized yourself for 300 odd reviews a day. You basically need to do it for 450 today. So where is the workforce? And how equipped is the workforce to be able to integrate, analytics, predictive modelings, and all of it? So with that, I will. So the message from this one is the touch points are significantly going to get reduced, and the processing will require a crunched turnaround time, because it talks to the patient's need of personalization. It talks to the patient's need of affordability, and it talks to the patient's need of holistic health. So keep that as a center. Look at how the disruptions are happening and see what it means to the functions or areas that you support, and begin to reflect. So with that, we can move to the next slide. All right. So like I touched upon in my conversation earlier, all of this is happening as we speak. We are in a moving ship. So what does it require us to know? We cannot be boxed with the functions or the silos that we operate today. If we are supporting functions, we really need to know what is upstream, what is downstream. So an end-to-end mindset is very, very important. Once we get to know an end-to-end view of what we support or what we are engaging to support, we should be clearly aware about the strategies that, or the blue chips that the business owners have, so that we really know that, it's not a lift and shift work. It is something I'm expected to create value. I'm expected to, make some, investments to improve the process, to derive certain outputs which talk to the blue chips. And all of this has to happen with close alignment of the cross-functional teams. So it would be, elements like your mobilization team, elements of your learning and development teams. And at the forefront is your front-end engine of due diligence and solutioning. How equipped are they? Are they really looking at the gaps between what is the business model and what is the delivery model, and how much lead time is needed for us to be prepared? So the sizing, the spacing of all the engagements is a function of an end-to-end mindset. Given that, all of this is happening, we have to continue to service the portfolio that we have and upskill our workforce or reskill our workforce and support the business model of the future. So we really need to have, our middle management and the senior level leadership well aware, in terms of well immersed, I would say, into the initiatives that could be digitalization, the impacts of EMR, and how the power of predictive analytics and data science can do that. So it's all not going to be, solved in a day's time, but the thinking has to begin. And very, very critical to the message here is where is our organization today? And that's one ecosystem that we support. There is workforce that is part of our current ecosystem. What skills do they have? What are the skills of the future? How can we get there? How can we keep them, kind of aware about the changes, and then the interventions and the lead times? And there will be some areas where there could be a glass ceiling, wherein it's a compliance requirement of a resource who's not licensed to take a review or to do a review cannot be moved to the process to the right. So that thinking has to come in more within the ecosystem of the organization. And the larger piece is, like I talked about, the nature of work. It's moving from bedside to more like a home care health in the example that I shared. How is the academe or the curriculum of the educational institutions aligned? Are they really seeing that change happening with them real time? And so what's our role with these institutions to support the workforce of the future, to see the employability quotient is continue to be high, and we kind of benefit out of the opportunities that are coming our way rather than catching up on them back end. So with that, I think I will leave you with the most powerful slide of my content. We can go to the next one. I thought this says it all. We need to rethink. We need to begin to reimagine. We need to reinvent, because disruption is happening as we speak. With that, I will pass it back to Kathy, please.
Thank you, Dr. Celine. Definitely a lot of topics that were covered in your slide, and it's very insightful. I have a lot of questions that I've lined up out of your discussions, but I'd like to kick us off in our panel discussion by just asking the question to Sir Jim, right? So what in similar ways are we seeing some of these changes that are occurring outside of North America and the US, given that most of our IT BPM and healthcare clients we're still servicing a great majority of that headcount in the US market. Can you share with us some insights as far as other global regions that you're seeing a similar change?
Absolutely, Kathy. And first, I'd like to say, thank you very much for having me. And Dr. Celine, fantastic presentation. I cannot, reinforce what you're saying. The disruption, frankly, is the new model of care. And what we're seeing outside, Kathy, is a massive wave of investments from non-traditional healthcare players, such as other technology players, telecommunication players, consumer industries. We're really seeing that digital enabled care is at the heart of this transformation. But I think, as Dr. Celine said, we have to think about, we know we have some of the best capabilities in the world regarding our staff, but we have to think about how are we going to carve out this opportunity? How are we going to skill up? If not, the risk of being left behind without thinking that this disruption is going to happen with us or without us. And it is the best opportunity. And I'll just, before I continue, but I just want to, the four things that we're seeing, which again supports what Dr. Celine says, we're seeing transformation and investment in more digital platforms, AI, machine learning, and mobile health apps. If I were to say, like, specifically what is going to support that transformation and where we need to think about getting more involved, maybe of our great skills that we have in the Philippines, we need to rethink that business model. Thank you.
Thank you, Sir Jim. I'd like to shift the focus back to here in the Philippines and locally. So this question is for Ms. Erica, right? Since you have a lot of connections and you work with a lot of our public sectors and DOH and PhilHealth, how are these global trends and changes? How do you see them impacting locally our healthcare delivery system? And maybe if you could talk about some of the opportunities that you see might be emerging in the local setting.
Yes, thank you so much. So I would like to follow sort of what Dr. Celine was talking about a while ago in policy, in care delivery, and then in health tech. So I think for policy, looking at what's happening globally, we have the Affordable Care Act, and yes, the government-based funding. In the Philippines, we are trying to focus on Universal Healthcare Law, or the UHC law, which we, because of COVID, we sort of kind of forgot to really drive and really implement, but we are working our way towards there. So rooting back in what's happening locally, we have to double our efforts in the UHC law. And a chunk of that is actually on health information systems and health technology in general. So what is happening right now in a health policy approach? In a health policy approach, we are having collaboration across different agencies to come up with guidelines to support these health information systems and of course, health technology. However, we need to incentivize and we need to build capacity among providers to improve automation, adaptation, data quality, and also implementation. So that's on the health policy side. When we're looking at care delivery, because we do have that foundation already in public health in the Philippines, but we have to look at it in a systems kind of way. So what are the systems that we could explore? Dr. Celine talked about home-based care, and he gave a perfect example on how it's going to look like in a life stage approach from beginning to end, or also in a treatment approach. But we should explore other settings aside from just a community or an individual approach. These settings involve schools, workplaces, and also, of course, hospitals and service settings that we have. However, another thing that I'm going to mention there, an opportunity, is to assess the health literacy of individuals and communities. How are they going to adapt to these global trends, and how will we be able to prioritize and implement these interventions? Because yes, we may be investing in technology, but if we are not working with the people alongside to use them, then there may be a lag, right? And then last, of course, going back to healthcare technology, this will scale health service delivery, but there's still that digital health barrier that we have to work on. And there are countless of studies and journals, again, like I'm a researcher, so digital health literacy will really impact the ability for us to seek, find, and change our health behavior. We already have these tools around, but it's not just an increase of the usage anymore, but the quality of the usage of these technologies that I would want to pose. And these are all opportunities that we could work together with in the local setting. Thank you.
Thank you. So I'd like to zero in and focus on a key aspect of us in the BPO industry and even outside the BPM industry, talent, right? This is a perennial, everlasting question all the time that we have sessions like this, because we have to adapt to changes in our ecosystem, in our clients, delivery model in the regions that we're servicing, right? And talent is a very fundamental, important aspect of our success in our operations, right? So with all of these changes that we're seeing in the healthcare delivery model and in technology as well, can you comment on how can we better position ourselves with our existing staff in our institutions, in our organizations? How do we help them upskill their current knowledge and better be prepared to face the future of all of these changes? So anyone can give their insight. Yes, Surjit, please.
Happy to give that a go. I don't think it's just the Philippines. Globally, you hear about this great resignation. People are reassessing their relationship to work, and remote work obviously became possible. We all are now zooming around. Technology, security, capability to deliver work-life balance. We have to be able to bring the best of, we know we have the best quality talent, but we also have to think about the value proposition we're bringing for the people, for them to be able to move around in their careers, possibly be able to travel. There is an engagement model where some customers want to eventually have some of that talent sent to the countries that they're working in. We need to reassess the overall business model. And this is not just for the health, I would say it's for the entire industry in the Philippines and abroad. If not, we risk people thinking of other choices and taking their talent and going elsewhere, whether that's physically or going to other industries. So we need to be more dynamic, not just with our customers, but also understand we need to be disruptive in how we service our folks. And again, we've been in the business. It's always a challenge. I'm not saying it's a magic bullet, but we need to reassess that. And the people who are successful at that will be able to get and retain and grow their business.
I'd like to jump off that one. So I do agree that we do start with assessment. I think that's always what we need to start with. We look at the needs assessment of the population or where we are. And then another important shift, I think, where disruption comes in will be in co-creating solutions. So when we get to work with these people and co-create solutions to, from the needs assessment, trying to figure out these solutions together with them, then if anything, we have to implement, monitor, and evaluate. Because if we don't track, then we don't know.
Yeah. Thanks, Erica. And the way it starts from is looking at the bigger picture. And if we look at the bigger picture, it is evolving for us as well as our stakeholders, right? Who basically may be working with us and asking us to support their work today. So they are also experiencing the change as we are experiencing, and maybe a little faster. That's one piece. The second element is, the skill gap. The skill gap, to Erica, what you mentioned is, skill gap is a function of us not comprehending the needs. So when you begin to co-create and collaborate, you begin to sustain. They will just limit. But I begin to think what those skills can move to 13 or 15 in a scale of an objective way. And my personal experience to what Jim talked about is there is a lot of difference in looking at what you do remotely and then what you experience, how it is done. So I personally have spent time in all levels of care, in terms of how an acute facility looks like, how a tertiary care looks like, how a skilled nursing facility looks like, how the movement or, discharge planning happens. And why I'm bringing that up is when you begin to see the impact that you do at different touch points on the care journey, will you be able to contribute to the solution? You just cannot sit behind and, say, okay, this is my solution. So it cannot be, siloed. So it requires a very, very strong vision of an organization, if that's the case, or a small business unit, to begin to integrate, get the cross-functional teams together on such solutions. And that basically will begin to feed into the skill requirements over a period of time. So I'll pass it back to you, Kathy.
Thank you. So there's a common theme here, right? Upskilling and being able to provide an opportunity for our current workforce to, upskill and learn new information and knowledge to be able to be successful and effective and be ready for these changes. I will dig a little deeper though. Although in healthcare, primarily our workforce are, professionals, nurses, USRNs, doctors, pharmacists, and all that. But with the emergence and more seeing that technology is an integral part of the change that we are seeing, how are you now foreseeing the nurse, and I will take that as an example for discussion purposes, the nurse and the future skill that is required for a nurse to thrive in this ever-changing, healthcare ecosystem?
Please go ahead, Jim.
No, please, Dr. Salim, go ahead.
No, I'll go after you, please.
Okay, I can just add where we are in the continuum. Right now, we're seeing a good opportunity where we have health professionals embedded with our product teams that are working on the development of basically software and integrating platforms. So right now, we still feel we're at the early days of this journey, but where we're seeing the opportunity is by embedding the professionals who have actually been involved in the process and can add real value. It really brings an additional capability to our development. So that's what we're seeing today. I do believe that those healthcare professionals, when they're cycled back, will be in a much better position to actually continue to help evolve the software because they were also part of the journey of the development. Thank you.
Yep. Thank you, Jim. So yeah, I was basically doing the similar line, and I think there's no job description of the future, to be honest. So if somebody says that they have nailed it down, then we need to meet that person. But to me, that's not the case. And so job description is a function of personal investment. So in this case, Jim, like he shared, is the need is an agile model. An agile model is that we have a huge, nurse population supporting the clinical review functions today. But an agile team, to Jim's model, suggestion is about how we look at outcomes of their reviews. How do these outcomes, like, it could be a readmission rate, it could be, quality of care, cost of care, whatever metrics we want to track. And then we leverage their experience, which is bedside, plus what they have done, and begin to have them support a team which is actually building predictive models. So how can I have an early detection of an ER visit right at the time 3 days prior? So those kind of elements are where you are not actually, basically moving away, Kathy, from your current skills. You're basically building on your skill base and contributing to the larger outcome. And so those kind of roles are something that are evolving. Then the other advantage that we have today is, since the disruption is happening real time, because when this work started to get offshored or globalized, at that point in time, I would say the domain expertise resided with the parent organization. Since the disruption is happening in parallel, if you are really at a point where you can begin to contribute, you can take the driver's seat on elements that will drive the thinking for tomorrow. So to me, that's the larger, case in point, opportunity that sits. But it begins from the talent pool themselves, that they have that in them. So there will be certain skills and interventions that will be needed for them to get equipped to begin to really, contribute to the future state role. And so, we can, kind of develop the conversation whichever way, but to me, it's a huge opportunity.
Yeah, I just like to sort of summarize that both of them mentioned all these skill sets, and then now we're noticing a mindset shift that we should encourage our talent, and we should encourage the skills aside from the skill set, but also just shifting how they view health in general. So IDEO mentioned that there is a mindset shift in health from moving into something that was reactive to proactive. And I think that's something that we could notice right now, that we want to empower these people to not just diagnose and treat, but move away from that. And then going back to what Dr. Celine said, I think this is the value-based care, looking at health outcomes instead of just the health services that we are providing. And by doing so, we are going away from just hospitals, but moving to communities and then meeting people where they are. So when we have our skilled workers do that, then we could move towards disruption in a more sustainable way with this shift in healthcare that we're seeing.
Thank you. And I'd like to digress a little bit in terms of the life cycle of our workforce, right? So we've had several discussions in other sessions in the past where we talked about academia and partnership. What do we want to see change in our grassroots? From developing these talents in college and being able to prepare them in a larger role. Yes, please go ahead.
Yeah, happy to jump in. This has been a challenge because I really think that this isn't just for the healthcare, but we need to upskill all graduates. The digital divide is really going to make or break countries, companies, individuals in the future. So anything that we can do to upskill our graduates with the knowledge of how are things. It's not just siloed. Accountant is not just an accountant. A lawyer won't just be a lawyer. A health professional won't just be a nurse or a doctor. They need to be digitally digitally engaged with the future. And those are the people that will be able to speak the language. While they may not have to do the coding, they must understand where AI fits in, machine learning, how that can empower us to have really a multiplying factor of the capabilities we have in the Philippines. So if I would have one wish, it would be for us to really engage that curriculum at a level that probably starts at even before high school and all the way through.
Thank you. And I think that's very important too. Dr. Celine, you wanted to add something?
No, I just wanted to piggyback to what Jim said. I think to me, you know, how it looks like is it has to start very early. And it's about associative and integrative thinking. It's not that, you know, I'm, you know, if I'm doing science and, you know, there's a geography subject, I have no interest in that. But you know what? The pandemic taught me that I need to know where I can travel. And when I cannot. So you need it or you don't need. The nurse needs to know the geography of this world, right? So it is need-based. And the other part is it'll get you to an advantageous point with the power of integration. So I think to what Jim mentioned, the efforts have to go in first to look at that who is actually disseminating the curriculum today.
Right.
It is not who is receiving the curriculum.
Right.
What is the mindset of someone who is basically teaching the kids or the nurses in this case or wherever, and that makes a huge difference to me. And that can only come in when they begin to see that this is what the employability will look like tomorrow. And if we do not have the skills, then it's a huge gap.
Thank you. I'd like to inject a question that just popped up in relevance to the current discussion. What role does HIMAP play to advance the academic curriculum to prepare, you know, the future Filipino workforce? And I think that's relevant as well. How can we, as an institution, as an organization, help the educators, right, to upskill or enhance the current curriculum of our workforce? The nurses, maybe the doctors, you know, allied health professionals. What is that help that we can extend to them? Because it also will benefit, you know, us in the industry. Sir Jim?
Really, this is a part I'm very passionate about. We need to create a HIMAP, and I'm sorry, I apologize. I was a former director or a board member of HIMAP, and I think there's so much value in which HIMAP can bring focus and a value proposition. The people who are in the education academe space, while they're regulated by DEX, you have to understand basically, you know, their journey on developing and managing curriculum as effectively a business. We need to do a better job of bringing a value proposition. They are sometimes sort of saddled with outdated models, and it's not that they don't want to impute this. We need to figure out bite-sized ways to bring them a value proposition so that we can bring critical thinking, we can bring technology into and show them that, you know, here is the critical path in which it'll add value to their students and their future job prospects. So it's, you know, full and fair disclosure, we own a college, so we are a little bit more familiar with the business model, and it's a challenge to change that long process of curriculum development. We need to do a better job. HIMAP, again, can be that catalytic messenger that helps deliver that value proposition. Thank you.
I'd also like to add to that as a professor as well. There really should be an initial analysis of our current educational system, especially with the pandemic. And I have seen, or we did have studies before that showed the impact of pre-service training and how they're going to choose which jobs in the future or where they're going to work. And by doing an initial analysis on these types of curriculum and what we have, then we'll be able to either, look at things in a systems way or have systems thinking to incorporate other things that will be the trend in the future in our current curriculum. But also the government should work harder to incentivize and work with these, institutions, training hospitals for continuous education and opportunities, even after they are, even after they study or they've graduated. So by looking at that, then we are giving opportunities for lifelong learning for these individuals and still incorporating that in our initial analysis of the curriculum. So it shouldn't just be, this person graduated and it's enough, but trying to incentivize these institutions afterwards.
Right. I would like to just revive that conversation because I remember I was part of a project from HIMAP back in 2006, 2007, if I'm not mistaken. We worked with the Regulation Commission, PRC, and the Board of Nursing to enhance the nursing curriculum, and that additional curriculum in the nursing program was actually approved. But somewhere along the way, the conversation has already stopped. And I think we have to start reviving that conversation again with PRC and the Board of Nursing, and not just the Board of Nursing, I think in all other professions too, because it's a lot of effort that we're put in. It will benefit a lot of our students, whether they work in the IT BPM sector or they work in the traditional healthcare setup. Information technology enhancement and knowledge is the way forward to everything that we do right now. There's nothing else that you can do without integrating technology into our daily lives, in our career. So maybe a call to action with HIMAP on that item. So I think we've talked about workforce for quite a bit. I'd like to shift our focus now in trying to digest the main, the center focus of our topic and the presentation of Dr. Celine into the business sector, right, and the employer side. So as a business in the Philippines, maybe you're a micro, small, medium enterprise or the big corporations. How do we better position ourselves? What do we need to do in order to adapt to all of those changes? Infrastructure, security, upskilling our talent. Sir Jim?
I'd like somebody else to take first. No, I apologize. I'm sorry. I'll be, again, I can't stop myself. I think that, again, we have such talent, but we have to understand and take the extra step, whether it's a SME or a large corporation, to spend more time to understand the language of our client, understand the landscape in which they operate in. What are their drivers? In essence, we're trying to help them solve a problem, whether that's because of efficiency, because of time zone turnaround, whatever, but it's also to spend more time. And I think HIMAP can also help bridge that gap. How do we bring back what's happening in the landscape, in the marketplace? Because we can have the best talent, but if it's hidden under a basket, and frankly, some of our competitors literally just outmarket the Philippines. It's not that they have the world's greatest capability, but they are out there. They are out there with their elbows out and they're pushing the agenda. So we have to basically not only bring the Philippine story out, but also bring the market and the language that all of our providers, all of the businesses here in the Philippines need to speak to be able to grab their fair share of the market. And frankly, they should be grabbing more.
Thank you, Sir Jim. Dr. Celine or Miss Erica, anything to add?
I think Jim covered. Erica, if you have anything to add to that.
Okay, so I'd like to take this time to post some questions that we've received, pre-registered questions from our participants. If you can just give me 1 second. And these questions fall mainly on 3, maybe 4 buckets, right? They talk about talent, which we've already covered. They talk about business opportunity. And what we have not talked about is really the effect of pandemic and how the pandemic has changed the way that we work, the way that we respond to these changes that we see from our clients onshore and other regions. So how has the pandemic changed your organization in the last 2 years?
I can go. Jim, you want to go first?
No, Dr. Celine, it's your time. I'm on mute.
Yeah, no, I think I'll just keep it short, but I think you all will agree it hasn't changed, it has transformed. It basically has, redefined the contours of human thinking. What was never even thought through is being done today. It is how we work, where we work, and on what we work. All the things, and the definition of work also has changed. But getting into, a little more, level 2 on what we've experienced. What we've experienced is hyper growth, of course, as an organization. There is a huge interest and need that we see that could basically transform into a larger opportunity for the overall geography. Because of the pandemic, there's been a huge demand for at least the clinical end-to-end functions. Obviously, there is a bedside requirement, so you continue to see kind of a lot of workforce taking on those opportunities across the globe. At the same time, there are a lot more who basically do not want to get to bedside and want to look at for alternative careers. So we've seen a lot of interest, and then the work from anywhere is something that is that we had never thought about, with data security and elements that no, this has to be in the office, there is PHI information and all of it. Now, I think over a period of time, there's been a huge investment on information security that the larger organizations have made as an investment. And it took us a time, right? It took us a while to first, fine tune it. It slowed us down. And then we found that there are huge advantages of that. That basically is allowing us to carve out opportunities for the workforce, which was never thought through. And what it is doing is giving a lot of confidence to the workforce that this is here to stay. And it is not like a stopgap job. I'll do it for 2 years, 3 years, 4 years, and look out for something. It is here to stay. They also, at least from the nurses' standpoint, some of them were not very keen to go to bedside at that point. Were able to, kind of gain through this. So from our perspective, it's been a challenging but a huge opportunity, and we are seeing huge interest from the workforce. I'll pass it over to you, Jim.
Thank you, Dr. Celine. I can only echo the pandemic presented a lot of challenges. I have a lot less hair since 2 years ago, but the opportunities of the digital transformation and what we saw was a greater shift from our customers. Again, some of the customers and clients, while the pandemic was at its rage, of course, anything to support the services, but then they started questioning the whole, well, when are you going back? When are you going back to the office? This security, that security, and yes, much greater investments in not just the engagement model for the folks, for our professionals, but also the meeting the higher level of IT security than often our clients have in their own shops. That's always a bit of irony, but it is led to more opportunities than we had pre-pandemic. And I would just say that we're never going back to the previous work, 9 to 5 or whatever shift from the office. I think we will be at some hybrid. What percentage, I don't know, but we probably will forever more be hybrid, or we'll lose people, because I just think that a certain amount of the staff are just not going to, they're enjoying a certain amount of lifestyle rather than being stuck on EDSA or wherever in traffic. And I think there's a value proposition that we need to accommodate for that. And that's my final answer. Thank you.
Thank you. And then maybe for me, I think I'm a bit more different because I'm a public health researcher. So my mode of or our work would really be data collection. And that's where I kind of want to talk about, as we have been amassing data more than ever. And the problem is because there were a lot of restrictions, and our usual mode of data collection was primary data collection, where we would travel and then collect. Then now it becomes a problem because of the different, data infrastructures that are not connected. So how then could we do our research? How then could we clean? How then could we process? And then now it's in technology. And now it's trying to look for that interoperability that we've been so wanting or we're still unsure of. And I think, not just focusing on our employees, but also in the line of work that we do, it really highlighted, or the pandemic really highlighted, the importance of public health and the importance of data. And now, how are we going to move forward with that? And with this data, what can we do? What are the things that we have to implement? So, I mean, it has been, I wouldn't say it has been exciting, but everybody here, I think, talked about their hair. So I'm glad I still do have my hair. But I hope this, this would end soon, or rather we get to adapt in this type of or moving forward amid COVID, and yeah, just focusing on how to do that with the problems that resurfaced. I wouldn't say that they weren't there before, they just finally surfaced, and now we're finally understanding it. Yeah, thank you.
Thank you, Erica. I think this has been a very engaging and interesting discussion in the last, I don't know, I lost count, maybe over 30 minutes already. I want to say thank you. I learned so much from our speaker, our panelists, Sir Jim, Dr. Celine, Miss Erica, for this afternoon. Can we maybe give our audience some final thoughts on how we can adopt and look forward to the future, while being very visualizing where we want to be? So maybe Sir Jim, you want to start, and you can go round table.
Thank you, Kathy. And again, I really appreciate the opportunity. I absolutely believe the Philippines has proven its nimbleness and capability to adapt in these challenging times. But we also risk, I don't want to say complacency, but we risk not grasping what Dr. Selena said, the level of disruption that's coming down the road. We need to be paranoid, because the business model can shift, and we need to be just in front of it. I understand in all running businesses, we all have P&L, and we need to make payroll. But if we're not investing in that, technology will potentially undercut or start sawing off the bottom parts of our value proposition. So I would say skill up, skill up, skill up. Thank you.
Erica, you want to go next?
Okay, sure. So again, thank you so much for having me. I think I just have 2 points. So because of the, the opportunities in the global trends and also in technology, I think, again, we should take a step back and maybe analyze and assess what we have right now, with our barriers and behaviors in health and also in technology. And that's only by understanding health literacy or digital health literacy, and really looking at what should be prioritized in the next couple of years for these investments. So I think, Jim and Dr. Celine have both mentioned all these investments, but I will speak on the end of the people and, who will use these interventions and these solutions. So yeah, in the middle of everything, it's really about co-creation, and it's really about sustainability and the people. Thank you.
Thank you, Erica, and thank you, Jim. I think I mean, you basically covered most of the elements. I just would like the audience to kind of take a few messages. First, great thank you for having me here. It's a privilege, and glad I was able to share some insights. I just have to say that I'm sitting here with you all. Somebody thought about this long time back, that translated into an opportunity, got me a job, like many others, and it created employment. So there was a thinking that got us to where we are. To Jim's point, it's so rapidly transforming. And I think it's our responsibility. We are seeing it, and it's happening so quickly. So we have to begin to think for the folks who will look for employment a few years down. So an honest reflection that I'm seeing this happen, this is coming thick and fast, 5 years down, 3 years down, depending on the function that we are talking about, will require something very different. So it's our opportunity to collectively contribute to the cause. I mean, my perspective is it will eventually require a village to get this done. But the thinking has to be there, the execution bias has to be there, and a conviction that we will fail, but we will still overcome it, is my sense to it. So we have to walk away positive, optimistic from this conversation, and do our bit of reflection of the work that we do and see the impact of it in terms of the thinking that we can get. With that, I will pass it back to you, Kathy.
Very well said, Dr. Celine. It was a pleasure and honor for me to be a part of this conversation and to have been able to moderate this afternoon session. So thank you, Sir Jim, Ms. Erica, Dr. Celine, for your time. Great wealth of knowledge, and I hope to be able to join in a conversation such as this in the future. So take care and stay safe. And at this point, I would like to give the floor back to Ms. Judy.
Thank you very much for that very informative insights from the experts. I really appreciate all your presence today. So to close our session, I would like to welcome the Corporate Secretary of HIMAP, Mr. John Day. John?
Hi, thank you so much, Judy. Honestly speaking, while I was listening to Dr. Celine's presentation and having to experience also how it is listening to Erica and Jim, I could not just, get a moment of my life to step back and smile, to be in an industry that actually kept all of us safe during this pandemic. But what is very salient, I guess, in this entire discussion is that the landscape is changing. The architecture outside of our offices are changing. And if we will not be able to adapt, we're not just going to lose the market, but we would also be losing that forefront leverage of, supporting an industry that is keeping us all safe because of the pandemic. There are just a lot of points that I would want to highlight. But I guess what really captured the attention, not just maybe of me, but of everyone, is the fact as to how Dr. Celine pointed it out, that in discussion of policy, care delivery, and health tech, what we have to look at this time is to rethink, reimagine, reinvent, and disrupt. As a close, I guess that pretty much gives us a call to action. And having been, as a board of trustee and a corporate secretary of HIMAP and a co-chair of the capability development, we also had to really be working closely with government agencies to upskill our manpower. And I think as a close, I would want to share to you a reading that was actually pointed out by Michael Porter, my professor in Harvard, when he said, at the personal level, almost everyone has a story about healthcare. Many of these stories have a happy ending and reveal the extraordinary skill and compassion of doctors and other caregivers. Too often, however, even the happy endings were due to personal determination, connections, or the ongoing intervention of family members. Some good outcomes seem to have occurred almost in spite of the system rather than because of it. And I think what we have to really understand is that we are inside the system and we have the power to redefine the healthcare. Thank you so much for sharing your time with us, Dr. Celine, Erica, and Jim.
Thank you. Thank you, John Dave, for your closing statement. Thank you, everyone.
Thank you.
Thank you, everyone.
Thanks, everyone.
Thank you.
Thank you, everyone.
Happy Friday. Happy
Take care.
weekend.
Yeah. We'll see you again
Bye.
soon in our next
See you.
learning session.
Yeah.
Stay
Thank you.
safe.
Stay safe.
Bye.
Stay safe. Bye-bye.
So we invite
Thank you.
you on March, first week of March, we're gonna have our first public information, wherein we invited the USEC director of the ICT. So we're looking forward to have you guys. Thank you for today. Have a nice
Thank you,
weekend.
everyone. Have a great day.
Happy Friday.
Happy Friday.
Happy
you.
weekend, everyone.
Bye.
Bye.
Hi, Mr. President.
Vince.
Hi,
Hi,
Vince.
Vince, Mr.
Hello.
President.
Great session today.
Thank you.
Congratulations. Thank you.
Hello to our friends, the ICT friends, Jihad, EMB.
Thank you.
Thank you for joining us.
Yes, thank you for joining us. Bye.
Our friend Jeanette Carillo, hello.
So we all have Sanjay, Ricky.
I saw
Sure.
Bachi in the call as well.
Glad you're
So,
here.
Yeah.
Thank you very much for joining
Yeah.
us.
thank you
Bachi
very
is
much for
here.
joining us.
Thank
See
you
you again next
guys.
time.
Jihad,
Mr.
And
Julian
Manel.
Payne.
Oh, Jihad
Thank
is
you.
here.
Yeah, Julian Payne also.
Mr. Julian Payne.
Oh,
Thank you.
Sir
Thank you,
Julian
Julian.
Payne's here.
Yes.
Thank you.
Thank you. Thank
Joining
you.
us.
Sir Ricky Ishak from World's Roars. Thank you, Sir Ricky.
Thank you very much. Have a great day. Bye-bye.
Thank you. Bye-bye.
Bye. Thank you.